Hello, I'm Dr. Helen PENSANTI, and welcome to Doctor, where medical conversation meets everyday understanding for you and your health. And today, we're going to be talking about a condition that affects millions, but is often misunderstood: irritable bowel syndrome, or for short, IBS. If you've ever struggled with chronic stomach pain, bloating, constipation, or diarrhea, and felt frustrated by vague answers that were given to you, this episode is for you. We're going to be talking about the causes, the treatments, and even future therapies like regenerative cells and neurofeedback. Joining me today is someone who brings both compassion and cutting-edge expertise to this field. Dr. Bryn Henderson is a pioneer in regenerative and integrative medicine with decades of clinical experience. He has helped countless patients regain control over their health by blending traditional care with advanced therapies. Today, he's here to share his insights on managing IBS, or Irritable Bowel Syndrome. We're going to discuss breakthrough cases using regenerative therapies. Welcome to the show, Dr. Henderson.
Well, thank you.
Well, let's begin with the basics. What is it?
Great starting point. IBS stands for Irritable Bowel Syndrome, and it's a long-term condition that affects how the gut works. It causes symptoms like stomach cramps, bloating, gas, and changes in bowel movements, either, interestingly, constipation or diarrhea, or both. What's tricky is that it doesn't show up in scans, blood tests, because there's no visible damage. It's more about the disruption of how the gut functions.
Is it a rare condition, or what's the percentage?
Not at all. It's actually quite common. 5 to 15% of the people worldwide have irritable bowel. It usually starts in young adults, and women are about twice as likely as men to be affected. So it feels like you're the only one dealing with it, but you're definitely not alone.
So what is the cause?
The cause isn't just one thing. It's a mix of problems with how the gut and the brain communicate. Gut bacteria imbalances, stress, early infections, and sometimes even genetics. Think of that, all these factors. Some people have very sensitive nerves in their intestine, which makes everyday digestion feel painful. Oh, it's terrible.
What are the most common symptoms people come and complain to you about?
Most patients describe stomach cramping, bloating, gas, and an urgent need to go to the bathroom, or sometimes trouble going at all. In other words, that's the swing between diarrhea and constipation. And then there's the fatigue, anxiety, sleep problems often go along with it and make even more irritable.
Well, how do you diagnose IBS and not know that it's something else, like you're just allergic to milk or wheat or something, and you're just having an allergic reaction to food?
We use what's called the Rome 4 criteria, which is based on how often someone has stomach pain, how their bowel habits change, and they are requested to keep track of that. But we always make sure there aren't any warning signs like weight loss, bleeding, or a family history of colon disease. Tests like stool samples, blood work, and sometimes even colonoscopy help us rule out other conditions.
So you're telling me you can do a stool sample and tell if someone has IBS?
We do stool samples to make sure that it's not something more dangerous, infections or cancers.
So you're ruling out,
yes,
not ruling in.
Exactly.
Oh, okay. So let's talk about how you usually treat IBS.
The first step's always lifestyle. A low food map diet, which cuts out certain hard to digest carbs, can be a game changer. Just regular exercise, managing your stress, and getting enough sleep becomes a big blessing. If it's not enough, we use medications like fiber supplements, antidiarrheal medications, or mild antidepressants This is tailored to each patient and an individual approach.
How important is stress in all of this?
Wow, stress is very important. The gut and brain are connected in what we call the gut-brain axis. Stress can trigger flare-ups, make pain feel worse, and disrupt gut function. That's why stress-reducing techniques like mindfulness, therapy, or even neurofeedback can be powerful tools for release.
Let's talk about the new and promising treatments. What's on the horizon?
Wow, that's a lot of exciting research on the horizon. Regenerative cell therapy probably leads the list. For instance, it's showing promise in repairing, actually fixing the gut lining because it's making new cells and it calms down the inflammation. It also has many peptides associated with it that help the motility. That's what BPC does. In addition, there's the traditional Chinese medicine and acupuncture, also being used more often to balance the body. Most of traditional Chinese medicine is focused on body balance, and it's excellent. The exosome therapy that we also use, those teeny weeny particles, vesicles they're called, that help cells communicate, is another frontier that's already helping to regulate the immune system and gut function.
Well, speaking of regenerative cells, you had a patient who went through that. Can you tell us about her?
Yes, she was 42-year-old. She had an IBS that had D, which means the diarrhea predominantly. And she came to us after 5 years of trying everything. She had dietary changing, probiotics, medication. Nothing worked for her. We tried some regenerative cell infusions, and she received 3 treatments over 6 weeks, and it resolved.
And how did she respond?
Oh, remarkably well. Her stomach pain and bloating went down significantly within 1 month. By the end of 6 weeks, her bowel movements were irregular and normal for her. Her anxiety dropped, her quality of life index score improved by over 30 points. And best of all, she didn't need any further IBS-specific treatment for 6 months.
That's amazing. Are there other holistic approaches for patients who prefer non-drug approaches?
Oh, absolutely. Acupuncture helps regulate digestion and reduce pain. Peptides, like I mentioned, they calm the gut down. Vitamins, glutamine, zinc, vitamin C all support gut healing and the immune system. Add neurofeedback, and you're absolutely going to help the brain manage the stress better and help those stress triggering symptoms in the gut.
So you have all this available in your clinic. A person can come in and have all of these things that you mentioned available.
Absolutely. We're blessed to have that results of that as well. We use a focus on what the outcomes are in our clinic. So we don't just do it, we want to make sure it works. We keep track of what you eat, how you feel, and talk to other physicians caring for you early. There may not be a one-size-fits-all, but there are a simple guide to teach patients, and that's called EASE IBS.
All right, let's go through that. What does the E stand for?
Eat smart, smaller balanced meals with fewer greasy or processed foods.
A.
Avoid common triggers. Track and reduce caffeine, dairy, or sweeteners.
S.
Stress less, use mindful or relaxation techniques to calm the gut-brain connection.
E.
Exercise regularly. Gentle daily movement improves digestion, increases circulation, and lowers stress.
I.
Include gut-friendlier fiber. Soluble fibers like oats and psyllium help regulate bowels.
B.
Balance your gut bacteria. Probiotics help. Symbiotics help more. Ask your physician for guidance.
S.
Stick to your treatment plan. Medications, supplements, or therapies should be followed consistent. With IBS, the goal isn't just managing symptoms. It's restoring comfort, confidence, and control.
IBS may be invisible on scans, but its impact is very real, as doctor has taught us. The good news is from food to feelings, from regenerative cells to neurofeedback and acupuncture, Today's options are more personalized and powerful than ever. I want to thank Dr. Bryn Henderson for helping us understand this condition clearly, compassionately, and I hope our viewers remember healing your gut is not just about digestion. It's about reclaiming your comfort, your energy, and your peace of mind. If you would like to see Dr. Bryn Henderson in person, I encourage you to call 714-639-4013. His office is at 615 East Chapman Avenue in Orange, California. That's in Orange County, California. And if you'd like to get in touch with me, go to my website, www.askdrhelen.com. That's www.askdrhelen.com. Until next time, I'm Dr. Helen PENSANTI. This is Doctor to Doctor, where real doctors share innovative information to bring hope to you for your health. Join us next time. Bye for now.